Therefore, you see the name Sarah Weyer. She is a second-year medical student at the University of Maryland. And this summer, as part of her medical training, she was sent to Malawi, which is in East Africa. And I didn't know this until we got this program. She put a PowerPoint program together for us. And I didn't know anything about the Doris Duke Foundation sponsored this, but this is a research project that is continuing in Malawi. The Doris, can I have the next slide, please? The Doris Duke Fellowship is a new malaria research training program at the University of Maryland for students interested in global health and related fields. Fellows spend 8 weeks of the summer after their first year of medical school doing combined laboratory and field research rotations in the malaria section of the Center for Vaccine Development at the University of Maryland. The Doris Duke Fellowship, the fellows spend 4 weeks at the malaria section in Baltimore before being trained in molecular epidemiology, research for training facilities on genetic diversity and the efficacy of malaria drugs and vaccines. Following 4 weeks at the laboratory at the CVD, fellows spend 4 weeks of clinical research training at either the Bandiagara Malana Project in Malawi or the Blantyre Malaria Project in Malawi. Malawi has a population of 13.2 million people. The child mortality rate is approximately 175,000 children per year. The number of physicians is 266. Adult HIV prevalence is 14% of the population. And AIDS orphans account for about 550,000 people. Malaria is a major childhood disease. Worldwide, 1 to 3 million people die annually. Malaria is a parasite carried by mosquitoes. Children under 5 are most affected. Multiple illnesses between 0 and 5 eventually lead to partial immunity in adulthood. Symptoms in uncomplicated malaria include fever, shivering, joint pain, vomiting, anemia as a result of low red blood cells. Severe symptoms can include enlarged spleen, severe headache, decreased blood flow in the brain, enlarged liver, low blood sugar, high hemoglobin count in the urine with kidney failure and coma. Severe cerebral malaria accounts for the majority of deaths, up to 1 in 10. Drugs to treat malaria exist, but most have lost efficacy due to drug resistance. In other words, parasites that have mutated their genes and are no longer killed by the drugs. This is the headquarters of the Blantyre Malaria Project that you see. They do research in malaria drug resistance. We can't do this in the United States because we don't have malaria here anymore. Doris Duke Fellows observe how clinical studies are conducted and learn what it takes to conduct field research. Here are 3 pictures of the Indorande Clinic. Indorande is a slum on the outskirts of Blantyre. The local clinic deals with all local health concerns, including malaria. We were surprised when we saw these pictures how poorly the area was, and they have tin roofs or canvas roofs and no sewage, no drainage, no water purification systems. It all comes out of wells and what they eat and what they drink is probably contaminated. The Indirande Clinic, where Sarah was, and incidentally, Sarah was not alone. She went over with 4 other students. The study clinic is next door to the government health clinic. Each morning, nurses recruit potential study candidates, basically children, by explaining the study to the mothers who bring them to the clinic. If the children tests positive for malaria, a simple blood test, the mothers are invited to enroll their children in the study. The study has access to all the best medications and medical care, so the children in the study benefit, while the results of the study can help children all over Africa. These pictures are the courtesy of Dr. Christopher Plow, a doctor at the clinic. And this is 2 little children that were brought in for testing. If a child is too ill to be in the study or to be treated at the clinic or becomes ill during the study, they are sent to the local hospital, Queen Elizabeth's. There, children are admitted to the special malaria research ward, which has the best medications and more nurses per patient than the regular malaria ward. And there is the Queen Elizabeth Hospital. Queen Elizabeth's is the best hospital in Malawi. Even so, conditions are far below what exists at a hospital in the Western world. In many of the adult wards, people lay on the thin foam mattresses on the floor when the metal bed frames are all in use. These pictures are from other wards in the hospital. We were not able to take pictures in the malaria research ward. However, they are typical of the conditions in most of the hospital. In Malawi, you must have a relative at the hospital to help care for you. They wash your sheets and clothing. You can see the wash outside hanging everywhere as it dries in the afternoon sun. The hospital provides 1 meal a day, the local dietary staple called nzima, very similar to grits, except with the consistency of stiff mashed potatoes. Anything else your relative must provide. This is the new pediatric emergency room in Queen Elizabeth's Hospital. And in the children's area in Queen Elizabeth, there are pediatric wing. They have wall decorations, and Sarah said that many of these were done by the older children who had been helped by this clinic. The Open Arms Infant Home. Apart from our time at the clinic and traveling, we took some time to volunteer at Open Arms Infant Home, a local charity run by a British expatriate, supported entirely by donations and staffed entirely by paid local Malawian women and a few international volunteers. The Open Arms Infant Home are for infants and children under the age of 2. All have lost their mothers, mostly due to AIDS, and their families are unable to care for them due to the high cost of formula. The ultimate goal is to reunite the children with their families after they have passed the first risky years of life and are able to eat a typical Malawian diet.
That's Sarah on the left there, holding that little baby.
I think she fell in love with all the little babies at the home. Here's another picture of Open Arms Infant Home, getting ready for lunch. And then the young lady on the right-hand corner is Katie, another of the Doris Duke fellows who came over and gets ready to feed one of the newest arrivals. And lastly is a final picture of some of the people there. Each team of 3 paid caretakers called mothers works together to care for 3 small infants and up to 5 older infants. Children are fed 3 meals a day and 2 snacks. This might seem standard by Western considerations, but it is a rich diet compared to most regional orphanages and infant homes. Sarah is back at college and would have loved to have been here today to do this, but she had a major test today that she's been cramming for all Thanksgiving weekend. She had sent, when Alice asked Sarah to do this, Sarah said, well, how long a program do you want? And Alice said, oh, I don't know, 20 minutes, half an hour. She said, well, I have hundreds of pictures. And she said, I don't think you'd want to see them all. But none of these pictures are pictures that she had sent us. And somehow I lost them, but I'll get them back some way on a computer. They're out there in cyberspace floating around someplace. But she really enjoyed her trip, and she had a great time. We have some beautiful pictures of the area, and it's beyond the slums that you saw in the photo. The pictures are really gorgeous. And Malawi is on the east coast of Africa, and so far they haven't had any problems with some of the terrible fighting that's been going on over there. Malaria is one of the most common infectious diseases in the world. It affects mostly young children and pregnant women. It has been difficult to treat because malaria parasites are particularly adept at developing resistance to drugs. There is no vaccine, although a few are in development. However, no one knows yet if they will be effective. More research is needed. I was privileged to spend a month in Malawi learning about its people, its culture, as well as clinical research techniques. So there you are. I can't answer any questions because I wasn't there.
You know what the regular diet is?
Sorry?
It said the children, when they're old enough to eat a regular diet, can leave. Do you know what their regular diet is?
No, I don't. But I would imagine basically it's mostly vegetables and maybe goat or, something like that. But they don't have herds of cattle like some parts of Africa or like we do. But you see a lot of goats, so I imagine goat winds up on the dinner table.